predictive, it is much more mathematical with the usage of miasms. And that is exactly where we are now. We have been reading Dr. Prafull Vijayakar Sir's books, and today we are reading about the end of my assumption of miasm. We have been taught about miasms in our college days, but then it was like a maze of collection of whatever. Like we were not able to define the miasms properly. But then now, with the association of Prafull Vijayakar Sir, miasm is considered as a defense mechanism, and he again and again proves that there are only three defense mechanisms possible. One is the inflammation, the other one is the construction, and the third one is the destruction, as seen in the physiological, our textbooks, medical textbooks as well. And rightly, our Dr. Samuel Hahnemann has given the names as SORA, psychosis, and syphilis. And see, the calculative method of a predictive homeopath will be just by seeing the medical records, we will be able to categorize the patient into a particular miasm. First of all, the miasm comes there. So with this miasm, you know what symptoms to pick up. What is the sensitivity of the patient? If it is a very destructive thing that you see in the medical report, a superficial remedy, an inflammatory remedy like belladonna might not be sufficient, or naxomica might not be sufficient there. We say that naxomica is a polycrest, which means naxomica has got a psoric, psychotic, and syphilitic picture. But then if the destruction is very severe, naxomica may not be sufficient there. Naxomica is more of pseudosyphilis, exaggerated syphilis, inflammation to the third degree, but then not destruction. So if it is destruction, then you need a syphilitic medicine like acid nitricum or Merxol, for example. So this is how you get that mathematical calculation in predictive homeopathy. For this, what is this miasm, or what are the different types of miasm? And what are the symptoms of the miasm? What are the physical symptoms and the mental symptoms of the miasm? This much every homeopath should be thorough with. And now today we are dealing with the birth miasms. All these miasms are there while a child is born into this earth. Sora is there, psychosis is there, syphilis is there. But then certain miasms are like certain miasm will be predominant. So when we say that sulfur is the king of antisoric, that doesn't mean that sulfur has got only and only soric. Sulfur has got a psychotic picture, and sulfur has got a syphilitic picture too. Even the rag seems beautiful, or collection of the stones and all are ragged philosopher and all is the syphilitic part of the sulfur. So every medicine has got every miasm, and every human being has got every miasm. Only thing, he is predominantly soric, or predominantly psychotic, or predominantly syphilitic. So every disease will find its expression as the soric only. Even if it is tuberculosis, even if it is cancer, even if it is dengue or anything, the first step will be the soric phase, or that is the inflammatory phase. When that particular defense is not sufficient to take care of the disease, body changes its gears and goes into the psychotic phase, or directly from the sora into the syphilitic phase, as the case may be. So if it is a running nose, for inflammatory stages, that means if it is for example, if it is a soric thing, you know how the discharge will be. It will be very acrid and excoriating discharge, and there will be never a bloody discharge. If from the day 1 or day 2 onwards there is bloody discharge mixed with the acrid discharge, what miasm is that? First of all, syphilis is involved there. The breakage of the capillaries is there. With the touch of the nose, it bleeds, and the handkerchief of the child will be always blood stained. What miasm is that? Mathematically, we all can immediately say that it is syphilitic miasm. And if it is psychotic, then what will be? There will be stuffed nose, and there will be postnasal drip. Everything will be hidden, and there will be the swelling of the turbinates. There can be polyps, and there can be snuffles. There can be total obstruction of the nose. Yes. And the DNS, that is the bend. If it is just a bend, then it can be psychosis because it is the swaying. Or if it is a typical demarcation of the bend, then it can be syphilis, that is the destruction of the bone, or the osina, the destruction of the nasal septum. So when you know the CT scan, when you know the report, scan, PNS, paranasal sinuses, you syphilitic case. By that, you know what medicine and what sphere of action is to be taken, is to be considered there. Am I audible?
Yes, ma'am.
Yes. Okay. So today we are reading the chapter 20, that is birth miasm. Now we are reading page number 169. Yes. Are you all ready? Page number 169. So we have talked about the change in the constitution. We had a notion that if the child is a pulsatilla child, then in the 20s or in the 30s also the lady will be a pulsatilla lady, and then in the later 50 years or 60 years also the lady will be a pulsatilla lady. Is it true? It can be true. But then is it okay if the lady changes from pulsatilla into lycopodium or into carbovage or into silesia or into anything else? Yes, it is very much okay. It is not necessary that once pulsatilla till death it is pulsatilla. It can vary. In the psoric phase, it will be a pulsatilla picture. Whereas in the psychosis, it can be psychotic pulsatilla or it can be one of its complementaries like lyco or carbovage or calicarb or calimur or anything it can be. So it can be from that relationship chart, or it may be it need not be always from the relationship chart. Okay, so you have to take the case again in the psychotic phase. You can always rule out pulsatilla because this, or rule in pulsatilla because this pulsatilla has helped in the younger age. You can always see whether it is still a psychotic or whatever symptom is coming up, prescribe upon that. So constitutions need not be the same always. Constitution can change. I'm reading a paragraph. It is not always that a constitution in psoric phase has to change into the psychotic phase of the same remedy. Okay? A psoric sulfur can change to the psychotic complementary, like a pulsatilla or a bryonia, which means a psoric sulfur need not go into the psychotic sulfur and in the syphilitic sulfur. No, it can change into pulsatilla or bryonia or whatever. If the genetic expression changes, that is the constitution changes, it has to go to one of the complementaries or relation of the previous remedy. Now, don't bias upon the complementary and the relationship. You take the case freely, and most probably 99% of the time, the remedy that you arrive at will be a medicine from the relationship chart or from the complementary chart retrospectively. Don't go directly if it was pulsatilla. If it is not pulsatilla, then what other complementary remedies? No, don't go like that. That will be a shortcut. Shortcuts never work, dears. Now, the next paragraph. Psychotic and syphilitic constitutions suffer from psoric diseases that will reflect the birth miasm. So, every child, when it is born, has got the psoric element also. So, this phase, or even if the disease is in the syphilitic phase, that doesn't mean that it has not undergone SORA. Without SORA, nothing is there. Any disease, be it cancer or tuberculosis or diabetes or any disease or hypertension, anything, it will start as an inflammatory response, which means it will start as a psoric response. Now, the next paragraph, that is, the question frequently asked is coryza or a dermatitis is a psoric manifestation, that is, the body is fighting with the physiologic defense. A thuja, predominantly psychotic, or a nitric acid, predominantly syphilitic miasm, never suffers from a psoric disease like coryza? That is the question. Thuja is already psychotic. Nitric acid is already syphilitic. So whatever disease that you get, will there always all these diseases will be psychotic or syphilitic only? Will there be no sora? No, there will be sora. There will be sora. Sora is the mother miasm. Without that, nothing else happens. So, if yes, then should he be given a psoric remedy or a psychotic remedy? See, all these are the questions which usually we have. So, Vijayakar sir explains that very clearly in the next paragraph. For the new joined ones, we are reading the book, The End of My Assumptions of Miasm. And today we are reading page number 169. Okay. So every constitution, whether it is psychotic thuja or syphilitic nitric acid, has to undergo first physiologic defense, that is inflammation, when it is attacked by a virus. So whenever a virus is attacking us, the first defense will be by default it will be soric. But then for the psychotic or the syphilitic, the soric phase will be very small. And luckily, if that particular virus got annihilated by the soric defense, the psychosis or the syphilis is not shown, but it is there in the background predominantly. But unfortunately, if the soric defense was not sufficient, the psychotic miasm, the thuja, will immediately shift its gear into the psychosis, as well as the syphilitic will immediately shift into the syphilitic destructive mode. It will not linger upon the soric thing. The birth constitution may be psychotic, but he has to show inflammatory response. The birth constitution may be syphilis, but he has to suffer from inflammatory response when first attacked by a bacteria or virus. But the reaction to the situation will differ in psychosis and syphilis. The inflammation will be there, but it will be for a very short time. If thuja or natrum sulf suffers from coryza and cold, the symptoms will be reminding us of psychosis. How that will be? The patient will not have free flowing transparent coryza of psora or irritability and sneezing of psora. You know what are the symptoms of psora when it comes to a coryza? It will be acrid, excoriating, freely flowing. Yes. And there will be a lot of irritability. There will be formication of the nose, eyes, ears, and the psora will be highlighted by a lot of sneezing and all sorts of irritation, both mentally and physically. Whereas if it is a thuja, it will be there for one day and that also not much irritation. The next day, what happens? It changes its gear into the psychotic miasm. The nose will be either blocked, that is snuffles, or there will be excessive discharge from the nose. And the discharge will not be acrid and all, it can be bland. The discharge will be more of yellow or greenish yellow color rather than transparent. If it is transparent, it is psora. If it is yellow, it is psychosis. If it is greenish yellow or green, it is light green, it is psychosis. If it is dark green, sometimes or altered color, sometimes blue color coryza. How many of you have seen that? I have seen blue color coryza. That is syphilis. And that is quite unnatural. Anything unnatural is syphilitic. Or if it is bloody, then it is syphilitic. So here, the discharge will be more of yellow or greenish yellow color rather than transparent. If the patient is predominantly syphilitic, like nitric acid or merxol, they will still suffer from coryza and cold, but the discharges will be excoriating bloody. Yes, excoriating bloody ozena. If it is diarrhea or dysentery, that too will be bloody in the syphilitic stage. Are you with me? Hope you all got it. Hi, Julie, Gokula Kannan, Mangala Rubini. Yes, Dr. Gopinath. All good? Then I will go to the next paragraph. Yes. Yes. Even the aggravation time of coryza in syphilitics will be as usual night or sunset to sunrise, whereas the psychosis remedies will be aggravated at their aggravation time. Yes. So if it is a syphilitic, the coryza will be much more at the in the night. The diurnal variation will be aggravation night for syphilitics, as you know, just like kali iode and all that. The sufferings will be much more at night, and the patient will not be able to lie down. The patient will have to walk up and down or come and sit in the front room again, switch on the TV and all that. No, like not able to get sleep or sleep aggravates. And the patient hates the sunset, right? All these typical symptoms will be there in the syphilitic cold and cough coryza. In as superficial as this disease, the syphilitic can be highlighted, the psychotic can be highlighted, and the soric can be highlighted, and accordingly you can divide your remedies. This is the calculation what you're talking about. The consequences for psychotics and syphilitics will be, of course, different. The thuja, natrum sulf, pulsatilla, medorinum, etc., if the coryza is suppressed, they will develop thickened nasal septum or hypertrophy of turbinates in keeping with their psychotic or constructive traits. So if the coryza is suppressed, they will immediately go to the next gear and develop thickening of the nasal septum or hypertrophy of the turbinates, and that is nothing but the psychotic miasm. The mercuries or the fluorides or bromines or acids which have predominance of syphilitic destructive traits will further develop either distortion of the nose, even the shape of the nose will be distorted, or go into destruction of nasal cartilage. We know all the distortions are syphilitic, and destruction of the nasal cartilage again syphilitic. So this is how, for just a small cold and cough, you can classify it into miasms, and you can classify your remedies also accordingly. Now the next paragraph. A phosphorus or a sulfur can be of any miasm. There can be soric phosphorus, psychotic phosphorus, syphilitic phosphorus. Similarly, there can be psychotic sulfur and syphilitic sulfur. It all demands on what were the inherited traits that predominate in the individual. If the inherited traits of sulfur have been predominantly soric, then this man will remain in sora even up to a ripe old age. What does this mean? Predominantly soric. Okay, so which means the birth miasm is predominantly soric, and the child anyway will suffer from all the skin eruptions and the atopic dermatitis, all the eruptions or eczema, oozing and itching, and a typical soric eczemas and itchings will be there, and the child grows into a young man, 23, 24 years, 30s, and there also he carries on with his soric traits, because he's blessed with predominantly soric. So he will not catch with the diabetes, or he will not catch up with hypertension or hypercholesterolemia and all. Always his blood reports will be normal, and he is always in the safe zone. Always his BP sugar levels are extremely normal. And now when he comes to the ripe age of 60 years or 70 years or 80 years, he is still soric. Why? Because he is predominantly soric. So when an 80-year-old elderly patient comes to you with a lot of itching and all that, no ectodermal cracks in the tips of the fingers, there is no bloody crack and all, okay, and some itchings and all here in the legs and all, not due to dryness and all, or in the groin area or anywhere in the body, some itching or some dandruff. What will be your comment regarding that? Because all this while you know that this person is protected by the sora, or the soric defense mechanism has protected him all through, from the birth till the ripe old 80 years. Now the patient is coming with this cracks of the hand, and you want to treat that, means that can sometimes, if it is suppressed, then it can go into the next level. After the 80 years, there is nothing much to look forward. So it can be dangerous. So what is the answer here given by Vijayakar sir? Then this man will remain in sora even up to a ripe old age. He will go on suffering from skin rash, boils, eczema throughout his life. Are you with me? These are generally lucky people. They will suffer from minor soric troubles, minor hypertension, minor diabetes, minor thyroid problems, etc. If at an elderly age, patients come to the physician with eczema, rash, or coryza, or mild backaches, be it any layer, guys, be it any layer, it can be a morning diarrhea, it can be of the second layer, a coryza, a rash, that is the first layer, or a third layer, a mild backache recurrently. It is always advisable to make them aware that they are lucky to have such minor problems, and any attempt, if not proper with a proper simillimum, may be too dangerous. Yes, guys? There was this case of a man in his 50s who came with a complaint of long-standing burning in stomach, diagnosed as hyperacidity with skin rash on the dorsum of hands since long time. See, this is why we think like Dr. Prafull Vijayakar Sir is a real role model teacher, because he is so courageous to publish his failures, and through his failures he has learned a lot of things, and he wants to share that through a book to the universe. Anybody can buy this book and read. So here he has given his failures, and through that he is giving us the corrections, like let us not make the same mistakes in our practice. Salute to our guru mentor Dr. Prafull Vijayakar sir. So here he is giving the example of this man who is in 50s, who had come with a complaint of chronic gastritis, chronic burning in the stomach, diagnosed as hyperacidity. And what else? Concomitants. Skin rashes are there on the dorsum of the hands since a long time. So what is this? So this is only soric. He was, after a long comprehensive history, prescribed lycopodium. The hyperacidity miraculously disappeared within homeopathy. The skin too started drying off, and the red discoloration disappeared and was replaced by black pigmentation. The hyperacidity is gone. The patient is so happy. This actually is a dangerous sign. Sudden disappearance of symptoms and the redness gone into blackness, all these are dangerous signs. The psoric manifestation was changing over to precipitation of excess pigments of psychosis. Excess pigmentation is psychotic miasm. All through the patient was only the psoric defense. Now the patient is gone into psychotic defense. This warning of the body was not heeded. The patient became a fan of homeopathy. Within 1 month, he was free of two distressing symptoms which the contemporary specialist had not cured for 15 long years or more. In the fifth week, the patient suffered from severe gastric upset and vomiting. His appetite had already slowly reduced. He was admitted investigations and was found to be suffering from jaundice. But the case was biliary duct carcinoma, which turned out to see, he was cured in 1 month and died in 2 months. So, what is the moral of the story? Let Sora be expressed. Like skin, respiratory tract, and don't treat it. Don't treat it. How many of you have understood this? Give me some indications, a thumbs up or a raised hand or something. How many of you have understood this? Mangala Rubini understood very good. Yes, Archana, Shiny Korean, yes. Amarnath, yes. So when the patient is in the psoric thing, in the psoric miasm, even if he is in the ripe old age of 80 years, such patients are the real luckiest patients, the most lucky people. So you can always advise, yes, let us not suppress this because there is no defense left for you. It can immediately take a different shape. So better to keep this disease. So don't treat it. The next point is understand of disease expression. Sora to syphilis. The moment you give the medicine, you have to always first look into the change of the miasm rather than change of the layer. Let the change of layer be there. But then whether the miasm is improved or not is the question. From the psoric miasm, did it go to psychotic miasm? And the patient says all the itch is completely gone, I am happy. But then the redness is changed into blackness. What change is it? The miasm from sora to psychosis, and that is a bad sign. Then you know that maybe the patient is in the psychotic miasm, the patient will be always in full form and they will be praising you and they will be praising homeopathy. That is psychosis miasm. Psoric miasm, always they will be like critic and they will be making faces at you and they will be showing that impatience at you. And but then sora is better than psychosis. The inflammatory is always better than construction. When the inflammation is there, there is always scope for complete recovery. And when there is complete recovery, there should be no marks and there should be no blackness. So if the patient has come for a psoric atopic dermatitis and after the medicine, if it has gone into blackness, your medicine is wrong. The miasm has changed from psychosis to syphilis. But the miasm has changed from sora to psychosis. Now I'm giving you another example of a syphilitic thing, that is lichen planus. In lichen planus, there will be a lot of papular lesions, blackness, thickness, wart-like excrescences. They are not warts, but then they are lichenification, lichen planus upon the dorsum of the legs, upon the knee joint, upon the elbows and all, bilaterally symmetrical and all you will get. They are not psoriasis. Lichen planus I'm talking about. Here, how can you mathematically give the medicine? XYZ medicine you have given, and how will be the follow-up? From the syphilis, it has to go into the psychosis. So the syphilitic symptoms are the patient is scratching a lot. And when will the patient scratch a lot? In the nights. And the patient has got sleepless nights. And the patient will be throughout the night in the bed, the patient will be scratching, scratching, and scratching. And the patient will be up to even bleeding can happen with the scratching. What's the miasm? Syphilitic miasm. And all this ugly thing to see also, no? And when the patient comes in, you have given the XYZ medicine, the patient says that itching is there. And then you see the spots, there are no spots or there are no papular lesions. And then you ask whether the itching is reduced. The patient says, yes, the itching is reduced, very much reduced. And you ask, when do you feel the itching most? Are you able to sleep at nights? Yes, I am able to sleep at night. Which means what? The syphilis is gone. The syphilis is gone. The itching is there. What is that itching? It is the psoric itching. The itching is the last thing to go. And what is the improvement, visible improvement that you see? From the papular, it has come to the macular. So here, what will be the color of the skin? It is thick and it is black. Then you say, this is psychosis, it is not good. But from where to where? From syphilis to psychosis. Is it good or bad? From syphilis to psychosis is good. From SORA to psychosis is not good. So here in lichen planus, the blackness remaining is good. And how long will the blackness be? The blackness can take its own time to get fully cured. As long as the mild itching is there, the psoric itching is there, the blackness is bound to remain, and slowly within 2 or 3 months, the blackness also will, the darkness of the blackness will reduce. In every visit you can see that the darkness, the intensity of the darkness is reducing visit by visit. And the itching also, itching will be there, and the patient will be complaining also, when will be the itching going? Then you know how the syphilitic patient was, very not complaining that much. The syphilitic patient will not complain that much, although they are having lot of sufferings. And in the psychosis, they will be praising you. Itching is very much less, and all this ugliness are gone. The raised, bad, ugly looking patches are all gone. Now only blackness is there. The moment the patient is coming to the SORA, the patient will say, again the itching is started. So much of itching. How long can I itch? And in the public and all, I cannot itch, When will it get cured? Then okay, you are going in the right track. The mind says the body also, no? Whatever you see on the body, that is talked by the mind also. The patient is irritable, which means he is pakka in the psoric miasm, and you will have to give 1 or 2 extra medicines marked as 1, 2 and all that to tackle the extra itching. Okay, you take this extra itching. So this is the, thank you Shubhangi. So this is the change of the miasm. Whether the layer changes or not, that is the secondary question. The first question is the miasm. From which miasm to which miasm? Then you can be syphilis has come to the SORA, or syphilis comes to psychosis and then to SORA. You can look into the gradations from the fifth layer to fourth layer to third layer, or from the fifth layer to directly to the first layer, etc. The descent of the layers. So now the third point here, what Vijayakar Sir is saying is, last but not the least, never be happy with fast or rapid cures in long-standing diseases. The patient is having a history of 20 years, and in 1 month the disease is completely cured, which means it is a time bomb. It is dangerous. Never be happy with fast cures in long-standing diseases. They are more often than not gross suppressions. So can you be happy if psoriasis is completely cured in 1 month? Everything is fast, everything is disappeared. Can you be happy? Sorry. Am I audible now properly? It is okay? Yeah. Okay. So a patient is coming with psoriasis. Yes. Or a patient is coming with something else, say diabetes. The diabetes is completely cured within, it was an insulin dependent diabetes, for example, and the patient has been putting insulin for the past 20 years. And you have taken the case. It is much more easy to take syphilitic cases, okay? Because they will be to the point, because everything will be so sharp in syphilis. The patient will be talking to the point and giving you answers. All syphilitic answers will be given to you. It is easier to pick it. Rather than psychosis, it will be time consuming. And because the patient has to praise himself a lot and will want to, it will be loquacious from one topic to another. They will describe the color of the hospital, the structure of the doctor, the nurse going, everything they will discuss in the psychotic miasm. It will be time consuming, and you will not get the symptom also. And in the psoric, they will be like lot of giving you pressure. They will be putting you in pressure in the psoric phase. In syphilitic phase, they are already kind of reconciled, and they will be rather contented and calm and all that, of course, than in the other way around, where they can be so jumpy, or like stramonium drug remedies, where they will be so jumpy and so panicky and all that. The normal physical destruction cases will be calm. Rather, they will be calm, or they will be silently crying or something. They will not be making a drama at all, like the psoric or the psychotic. So it will be much easier to take the case. And in this, insulin dependent diabetes. Will there be any drama there? No drama. Nobody even knows that the patient is having diabetes. And here you will be giving one XYZ medicine, and the patient says that yes, you got the crux luckily, and you gave the XYZ medicine. Within the next 3 months, the HbA1c is all normal and the patient is ready, or the patient falls down with a hypoglycemia and the patient withdraws the insulin. The patient is all good and you are happy and the patient is happy. Now, can you consider this as a good sign or a bad sign? 20 years history is gone in 3 months. The patient is out of insulin. This is an example, okay? Can you consider this as a good sign or a bad sign? Swati is saying bad. Yes, dear. Mangala Rubini is saying bad. Why do you say it bad? It should decrease gradually, says Swati. Yeah, it has taken 3 months' time, no? So, what is it here? Some Herring's law should be produced. Proper Herring's law should be produced. Medicine is sharp. Because this can happen in your clinic, dears. It has happened to me. Good sign. Dr. Gopinath is very confident. He is saying that it is good sign. Provided you get the Herring's law. And I will give you a very bad example also now. A lady, she had for psoriasis. How is her psoriasis? Psoriasis can be of any miasm, synthetic miasm. Now come on, what are the, how will be psoric? Sorry. Am I audible now? Not
Yes,
audible?
ma'am. Yes, ma'am.
How
Please
will be
repeat
the
it.
psoriasis? There will be a lot of itching. There will be a lot of redness. Yes. And that typical silvery scales. Yeah, in the psoriasis, there will be that symmetry of the psoriasis will be shown, and then there will be itching, and it starts as the red eruptions, or sometimes it can be upon the palms and soles. All the different kinds of psoriasis are there, no? Or it can be lot of scales and with lot of itching in the daytime. So this will be the psoriasis. Now coming to the psychotic psoriasis, the scaling will be much more and the eruptions will be bigger, and then there will be lot of thickening of the skin, more papular it will be, and lot of scaling will be there. Raw and all will be there. And if it is the syphilitic, there will be extreme redness. What do you mean by extreme redness? Scarlet red, cracks. There can be cracks and there can be scarlet red color, and there can be little bit, it can go into the joints also, bleeding, and the patient will not be able to extend the hand. There will be lot of restriction of movement, tightening will be there. And yes, so this will be the syphilitic psoriasis, and it was from head to foot. There was all this hair falling was there, and then dandruff used to fall like clouds. You can see the dandruff everywhere in her head and inside the ears. There was pus discharge also, and there was offensive. What is offensiveness? That is again syphilitic, bad smelling, and all through from neck everywhere the skin is all excoriated to the core, and too much of redness and scarlet red. It was typical syphilitic, losing of skin. I gave her Merxol 200, one dose. What happened in that Merxol 201 dose? What are you expecting? The syphilitic thing has disappeared totally. And the patient is coming with sleeveless dress and all the next time. See, all the skin, everything is gone. It is reducing so fast. Every day it is reducing. Every day it is reducing. I want to take pictures of that. Fortunately or unfortunately, she did not take the pictures. Okay, that was my first experience also like this. Okay, so fast homeopathy, that is rapid, gentle, and permanent. Okay, with homeopathic medicine, with one dose, such a miracle happens. All the happiness ended after 2 months. Again, my internet is unstable. Audible?
Now it's okay, ma'am.
Audible?
Okay.
Yes.
Audible, ma'am.
Okay. All the happiness started, all the happiness stopped after 2 months. So what is happening here? The patient comes, Madam, I'm all right, I don't have any problem. See, but there is some kind of an eruption happening in this joint area, in the bend of my elbow. That will go now. I said, yes, it looks like a psoriatic inflammation, and I explained the theory. Okay, all after all the syphilitic things in their own terms, I explained, not in the homeopathic terms. Yeah, the syphilis is gone and the psychosis is totally disappeared, and now a little bit of psoriatic eruptions will develop. That is all psoriatic only, so nothing to worry. It will take its own time, but then it will totally disappear. And I did not repeat any medicine. I just gave, of course, you know what. Then what happened? This turned out to be syphilitic again. Again, all over the body, it started coming up. We can't believe like what is happening. Hell is happening in front of our eyes. So what all has disappeared has come back again, bombarding again. So that was a bad sign here because we did not get any hearings law. Suddenly, like no, everything was, you can imagine a paper where the child has scribbled everything. Oh, it is, you can't see that. You take a new page, you take the next page, and it is so clean. That was how this girl's example was. Everything from head to foot is totally disappeared with one dose of Merxol, and the patient is all clean for 2 months. There was no hearings law. There was no hearings law at all. The patient did not come for anything else. No other complaints were there. So that was a time bomb. Then you should have known that no, all this magic is only ugly magic. This is going to bombard. You should be able to judge that. You have to look for the hearings law again and again. Okay, dears? Now we are going to the next paragraph. Are you ready to go to the next paragraph? Yes. So that is mixed miasm. So only these three miasms are there, or what about the other things? Mixed miasms. Very often, an individual might have predominantly physical and mental traits of psychosis and a few traits of syphilis. This amounts to psychosyphilitic constitutions. If the traits are more of syphilis, that is destructive pathologies, destructive mentality, and a few traits of psychosis, that is slyness, deceitfulness, showmanship, etc., we can call this syphilopsychotic constitution. Same is true with the miasm of Sora. Similarly, therefore, we can have sauropsychotic, saurosyphilitic, syphilopsychotic constitutions. Here, Vijayakar sir has written it this way. We are used to saying it as psychosyphilitic and all that. Of course, it can be syphilopsychotic also. That's what he means to say. You all know what is sauropsychotic, psychosyphilitic, saurosyphilitic, and all. You are all thorough with, I know. Now, what is the significance? Determining the predominance of miasm helps us to determine the remedy or the similimum, as will be discussed later. So if it is a predominantly syphilitic remedy, of course you will have to give a syphilitic remedy like Merxol. And then you have to look into the follow-up carefully whether the miasm is shifting from the syphilitic to psychosis or to psoric. Ideally, I would say that from the structural where you can see visibly upon the physical domain, if the disease is seen, better it go little gradually. From even with Merxol, it should have gone gradually from the syphilis slowly to the psychosis. Temporarily, the psychosis will be high, and then the psoric will, and then the psychosis will reduce, and then the psoric will come. This is happening in front of your eyes, and then you know that okay, this is going towards complete cure. But suddenly, if it all disappears, then you have to again and again look for Herring's law. If there is no Herring's law offered to your eyes, then you know that okay, he was a Jawan. I think I had given this example before, but then anyway, for a revision, I shall give this example. He was serving at the army, and due to some, some self devaluation or something like that, he developed psoriasis and he developed the psoriatic arthritis. How was the presentation? This young man, newly married guy, he was sitting with crippled fingers. All his fingers of the legs and the toes were crippled, and there was lot of uh, dandruff, scaling of the skin. Wherever he sits, the scales will be formed. So, what is this? This is psychosyphilitic. When it is a psychosyphilitic case, you will always get it as a little bit slow process. Then there you will have a control of the disease rather than frank syphilis. Frank syphilis can suddenly go into like this way, that way, or it can be like hysterical also. Suddenly one day it will not be there. Suddenly the next day it is coming in full blown and all that. No, like that hysterical element also will be there, and which adds sharpness to the syphilis, making the syphilis little bit difficult to treat the hysteria because it is unpredictable. This was a case of psychosyphilitic, and so that the that's why the speed is little slow. So you can catch hold of like what is happening in the patient before you jump into any wrong conclusion. The pains, how will be the pains? The syphilitic pains again in the night. The patient hates sunset. In the daytime, at least little bit after the sun rises, no, he will be able to little bit eat or little bit hold the spoon and all that, or take his bath and all that. By evening 5 p.m. onwards, he will start the terrible pains, the syphilitic severe pains. Through the night, he will have to sit and suffer the pains. And after case taking, I have given the medicine Oramet. Yes. Oramet is again has got psoric also, psychotic also, syphilitic also, but then Oramis, it is kind of a predominantly syphilitic. It can it psychosyphilitic only Oramet is. So I had given that medicine, and what happened? All the syphilitic pains are gone. The syphilis is gone, and the patient was not able to do the like arthritis deformants. The deformity of the hands were there, but then the first symptom was the pain. The syphilitic pains are gone, and the patient is able to sleep nicely after a long period of time. And the patient was concerned about his looks. What is that? The mind is turned into psychosis. The looks. Look at my hair. Look at my dandruff. Look at my fingers. The pains are not there, but then the patient is worried about his looks. Well, you know what to give. The syphilis is now coming to the typical psychotic thing. You have to just wait by giving SL. Okay, I explained and gave some SL, and after that, slowly the deformities also started becoming normal. We gave him some exercises also. No, like what is the best example, best exercise given for arthritis deformants or any pain or crippled feeling of the joints, MP joints, metacarpophalangeal joints. Sit upon that under your thighs. Under your thighs, you have to keep the hands. Sit upon that with your own body weight. You will be having a controlled movement, controlled pressure, and with that, no, it helps in the straightening of the fingers, and all his fingers became normal. And all through, he was complaining about the long process of the psoriasis. Why is it taking so long, etc. So this is actually a good sign, but then the patient will be having that all sorts of impatience, the psychotic impatience, and the feeling of the looks and all that. So this is how every case is different according to the miasm. So if it is a frank syphilis and if there is a hysterical element, then you will have to be extremely careful. The first thing what you look for is the change, the shift of the miasm, and then the Herring's law. Okay, dears. This much is okay. Can we go into the next? Can we begin with the next paragraph, next lesson? We shall at least begin with that, no? Yeah. Thank you, dears. So that is chapter 21. At least we shall discuss a few things in this chapter. Additional miasms. Have you all heard miasm, typhoid miasm, etc.? Yeah. So this is how actually there should be a standardization in homeopathy. According to everyone's experience or the stalwarts, the experienced doctors have given such kind of miasms. What does this mean? Does those miasms exist? So this is the question handled by Vijayakar Sir now in this chapter. What about the additional miasms? There is a lot of hue and cry about tubercular miasm and cancer miasm, etc. There can be two possibilities. Okay, if there is tubercular miasm and cancer miasm, whether this tuberculosis and cancer were not there during the time of Samuel Hahnemann, and if Samuel Hahnemann could through his foresightedness, he could kind of invent or kind of discover a natural theory of similia similibus curanter, and through that, by his keen observations, he understood that there are a category of patients who always fall under the itch category, and certain category falls under the figwort category, and certain category fall under the chancre category. There the base symptom will be chancre, and all the diseases, whatever the layers be, whatever the disease be, the destruction can be seen at every domain, not only on the skin, in the nose, in the eyes, in the mouth ulcer, in the joints, everywhere you can see destruction for the people who are having tendency for chancres. This was found out by Dr. Samuel Hahnemann. Even while brushing the teeth, they got an injury, and that injury will go into an ulcer, and then it will be a non-healing ulcer, and then finally it will go into cancer. What is the miasm? That is the syphilitic miasm, or the base is the chancre. And there are certain people who are having always some sort of skin excrescences, warts, skin tags, blackening, thickening, here a skin tag, there a skin tag, and whatever diseases they get are going into such kind of growth things, any benign growth. Cold means there will be some glandular enlargement. Thyroid means there will be a goiter. Liver means there will be a splenomegaly or hepatomegaly or hepatoma, or some gallstones or gallbladder polyps they can have, or fibroids they can have, or fibroadenoma breast they can. Everywhere there is a growth pattern for those people who are having tendency for warts. And for those people who are having tendency for itch, or when you consider this itch as the base thing, such people are always having some superficial things, some scratching, some itching, some excoriating, or some cold coryza, cough, or something like that. So this was found out by Hahnemann. Why did he fail to see the cancer thing, or why did he fail to see the tubercular miasm then? So even the tuberculosis can be fit into the itch category, or the figwort category, or the chancre category. Similarly, the cancer can be fit into these three categories. Or you tell me any disease, corona, COVID, any rax fever, anything can be fit into the soric, psychotic, or the syphilitic. This is the reason why there is no need of an additional miasm. Now let us read into the book. The first point is Hahnemann, these are the two possibilities. The first possibility is Hahnemann was right when he propagated that there can be only three miasms. Our theory of miasms as defense confirms Hahnemann's observations. So when we consider miasms as defense mechanism, this was not unfortunately taught in our college like this. Some, some vague teachings were given from our college days regarding the miasms. Here we are getting it as much more clear. Miasm means it is the defense mechanism. Defense mechanisms are three. Either it is the inflammatory, or the constructive, or the destruction. Now, what is the second possibility? Hahnemann was wrong, and there are more miasms which Hahnemann did not think of. In the first place, could Hahnemann's fantastic foresightedness ever have missed to recognize common diseases like malaria, tuberculosis, leprosy, typhoid, etc., having original tendencies to cause diseases and stamping them as miasms? Will Hahnemann ever would have missed all these things? Malaria, see, malaria was prevalent at that time, no, through this China bark that Syncona officinalis by translating Cullen's Materia Medica. With that only, Dr. Hahnemann first of all identified, or rather discovered, homeopathy. Malaria was present at that time in that century. So why did he fail to see then? He understood that in malaria also. That is the reason why he did not put any diagnosis for the disease. The moment you put any diagnosis for the disease, you will be hooked in that. So actually, malaria means it has got an inflammatory phase, it has got a constructive phase, and it has got a destructive phase. This is the reason why homeopathy still stands the test of time. Any disease, or any disease which in future also, whatever diseases are going to come can be tackled can be classified into the inflammatory, constructive, destructive medicines. So homeopathy is the real futuristic medicine, guys. So, um, what were the diseases at that time? During the time of Dr. Samuel Hahnemann, we had cholera, we had scarlet fever, typhus, smallpox, yellow fever, malaria, tuberculosis, syphilis, all these were identified at that time. And Hahnemann could classify all these things into the psoric phase or the even the psoric predominantly psoric persons can get syphilis as a disease, but then how it will be, at the most it will be some kind of an STD kind of thing, even AIDS, but then it will not be so pronounced and it cannot go into the destructive phase and all. Whereas if it is a VDRL or a sexually transmitted disease or a typical syphilis, then it will be going into the chancre and all that. Otherwise, it will be just having the lymph node enlargement or the bubo. So this is how Hahnemann has classified that. Even the syphilis were classified. Even the cholera, scarlet fever, typhus, smallpox, leprosy, typhoid, malaria, tuberculosis, everything could be classified into the either the itch miasm or the figwort miasm or the chancre miasm. So as to say, the itch, figworts, and the chancre was the base of the disease. For any for any theory to be given credence, it requires to stand the test of time, to have its base soundly placed on firm ground of science. If it is even if it is a hypothesis, the theory should reflect the holisticity of science, especially when it is a holistic science like homeopathy. This means it cannot be that the hypothesis is true only in mentals or only in physicals. The theory concern should make a given science complex science which has been misunderstood. And the last one is it should be able to explain all unexplained features of homeopathy. So I think I should stop here. So the only thing what our master is saying, like our master Prafull Vijayakar sir is trying to say is that it should hold good for mental generals and physical generals, not only to one domain. If the patient is having a psychotic physical disease, he will be already having a psychotic mental thought process. If the patient's disease is in the syphilitic phase, the patient will be already having a syphilitic thought process, and vice versa for the similarly for the psoric. Now, if the patient is having a psoric disease on the skin and the patient is having angry redness of the skin, what will you be asking? Okay, you are having so much of redness on the skin and lot of dermatitis there. When did this happen? The patient will be saying, yeah, it happened 2 days back. Were you angry with somebody? Yes, doctor, will be the answer of the patient. And if it is a psychotic, how that will be presented? The anger will no, doctor, I was not angry and not. It will be hidden. Yes, Arya. The anger will be hidden and the patient will be having, of course, it will not be an acute thing, it will be a chronic thing. Chronic, maybe inframammary area or in the axillary area, in the hidden areas or in the groin area. Since 1 year, I am having this itching. And there is little bit of scaling is there, lot of dryness is there, and it is spreading also by the margins. It is spreading day by day. So something is hidden there. Then you ask for if it is anger, then in the sora it is anger. In psychosis, what it is? It can be hatred, or it can be some hiding anger or some revenge or something or malicious on the slide, such kind of things. All the hidden things will be there. And if it is syphilis, come on, tadak, on the face. It will be rage, it will be mania, it will be insanity, or it will be what? Anger with destruction or abusive words. Such things, no? Violence, yes. That was the word I was thinking for. Anger with violence. Physically also it will be full blown and violent, just like that girl. Yes. So that's how the physical plane, the mental plane, everything can be correlated. This is the mathematical calculation. So there will be no flaws at all. Every question will be answered without learning anything by heart. Yes. With that note, can we end today's class? Or any quick doubts are there? All good? Anger with biting, striking, spitting. Yes. Shiny is giving examples for syphilitic. Yes. What will be the psychotic biting, striking, spitting, and all can be sometimes psychotic also, now. How that will be? Without giving the pain. It will be only threatening. Psychotic will be biting, threatening, and it will bite also, but then without hurting. The syphilitic bite will be violent. Yes. Okay, yes. Bye then. Bye, dears.
Thank you, ma'am.
Thank you, ma'am.
Thank you, ma'am.
Yes. May you all
Thank you,
have a
ma'am.
lot of patience. Treat them all nicely. Share your success and failures. Bye. Goodbye to all.